Now, what do you think the most common cause, of acne, in your opinion? Welcome back to the show. We now have Dr. Wendy Sadoff. Thanks for coming back.
My pleasure.
Appreciate it. We're talking about acne, and our last guest was discussing her experience. It's very common. How common is it in your practice, would you say?
It's extremely common.
Yeah.
As a dermatologist, I treat acne all day long, and not just for the teenagers. Acne extends into the young adults. Even as she mentioned, her mother, who's 60, has acne, and we see that. So it's very, very common, and it gives us a great opportunity to offer the patients a lot of different treatments.
Now, what do you, when you have a patient that has mild acne versus serious, what kind of advice do you give them?
There's so many different types of acne, and you're right, as soon as I see them, I'm kind of putting in my mind, categorizing, is it mild, moderate, severe, but also what's the predominant lesion type? In other words, do they have mostly blackheads and whiteheads? Do they have more of the, as I call them, the juicy pink ones? Do they have the deep, painful nodules? Because different medications are really aimed at treating different lesion types. And I also look at the patient and I think, how bad, does it bother them? Because we're looking for, in the teenage population especially, for them to be compliant and consistent with a regimen. Right. So what will they do? Are they too busy with other things that they might not do something more complicated? So it's partly how severe the acne is, the lesion type, but just their general life demands and what they might use.
And also what their expectations are. I mean, if you have somebody who's really, really worried about it and it's affecting their self-esteem, you may treat them differently than somebody who's not. Now, there are lots of over-the-counter medicines for acne. When should, if I'm having a problem, when should I see a dermatologist? When is it time?
Again, it depends on not only how much disease or how much acne you have. For one person, it might be just a couple of blemishes is bothering them so much that they really need to know that they're going to get it handled in the, in the physician's office and having access to all the treatments possible. Because, as you mentioned, acne really is a very upsetting condition, and it isn't necessarily correlating with the disease severity. In other words, you can have someone with 2 small blemishes who is more affected by their acne, staying away from others in school, staying away from activities. That may affect them more than someone who has much more significant condition. So again, even with just a few lesions, if it's bothering them, I think they should go to the dermatologist. It also helps for them to know I'm doing everything I can for it. If I make my appointment, I keep my regimen up to date, I give feedback to the doctor on what worked, what didn't. I'm doing everything I can, and that reduces a lot of the stress associated with it.
Absolutely. And great tips. We're pointing out again and again is this is a disease on the outside and the inside. It is essentially that even if you have a few lesions, it really doesn't matter, because what happens is that if it's affecting you on the inside, please see your doctor, please see your dermatologist. And what happens is that then you're empowering yourself, is what you're saying. You're saying,
exactly.
This is no longer my fault. I'm doing everything I can to help with this so that it makes you feel better. Great thing. Now, what do you think the most common cause of acne, in your opinion?
Well, in general, it starts with, under the influence of the hormones as a teenager, the oils that were previously so thin and like water are now sticky and waxy and clogging. And those oils and waxes, as well as the skin cells that line the hair follicle, get plug that opening. Okay. And you end up with a blackhead or whitehead. And then it becomes inflamed, and they can end up with cysts. So it's really just the hormones and changes that occur during adolescence and genetic tendencies. So there are some, the children...
Like Desiree, whose mom had acne at age 60, okay.
And I think if an adult has had very severe acne, has suffered with acne scarring, they should certainly have their child seen by a physician sooner rather than later, so that any scarring is really prevented.
What about all of the misconceptions that it's all caused by stress? or that I ate chocolate and I had greasy foods and boom, it came on, and I got a zit right away. What about all those concepts? What are, any truth, any of that?
Well, I think that's the tough thing about that. Oh, I ate this and then I got this terrible breakout is so unfortunate, because then again the person, as well as feeling bad about themselves and how they look and staying away from others, now feels like they caused this or brought this all upon themselves. The studies looking at food and acne are pretty iffy for the most part, and I don't give any specific restrictions to my patients.
Good.
These are teenagers. I mean, they have a tough enough time. In general, we hope that they're eating, in a good, healthy way. But I don't say, well, if you ate pizza, that blemish is your own fault.
Exactly,
that was kind of, that was...
Because they have a tough enough time with body image and restricting this and that to begin with.
Right, right.
Important points that Dr. Sadoff is bringing up is that, number one, there's really no good evidence that any particular food really helps. There may be some tendencies in individuals, but really, across the board, no recommendations can be made. And it may be a problem just with who you are, in the sense that you're a teenager, you're going through this time, and the hormonal changes that occur with being a teenager may be causing some of these conditions to get to be where they are. And what you can do is go see your doctor, do the best you can, and importantly, have a good self-image. Don't blame yourself, or don't say that I'm doing something wrong. Great bits of advice. We have to take a break. When we come back, more with Dr. Sadoff. Please don't go away.
And I've seen kids get into a bad cycle of starting to apply any number of home remedies that can actually make the acne worse.
Thanks for staying with us. We're talking with Dr. Sadoff about acne. At the break, we were talking about something, we talked about when should people see a dermatologist. Why else do you think that people should see a dermatologist fairly early?
Well, as soon as it starts bothering the teenager, they start asking their friends, or their friends offer advice. And I've seen kids get into a bad cycle of starting to apply any number of home remedies that can actually make the acne worse. Whether it's toothpaste or hemorrhoid cream or egg whites.
Hemorrhoid cream.
It's nice. On every blog. So that works, to reduce the inflammation of the blemishes. So they start using a lot of things that are, at the very least, not going to be effective and actually can make the acne worse. Then they start that cycle of picking and feeling very bad about what they're doing to their own skin. And that is a very difficult pattern to break.
It's unbelievable. And so the point, at home is that if you see your doctor early, it serves the point of education. Education by breaking all the myths, and education about not using all these. Desiree talked about every single person has advice for you about what worked for them, and it's 100% and it doesn't work for you. So great points. Now, the psychological aspects, we touched on that, of this disorder or condition can be significant. Do you see that a lot in your patients?
I see that all the time. Sometimes a patient is more forthcoming with that, saying, I'm missing school, I don't want to try out for some activity, but you can really sense it in the patients. And as they improve, you sense the release of that and that they've actually become more social. Sometimes it's even in body language. They come in and kind of all into themselves, and as their skin clears, they're more open. They may even shake my hand. They're much more outgoing. It's a beautiful thing to watch.
The nonverbal cues that you can see.
Exactly. And sometimes there are situations where it doesn't really seem to bother the patient, the teenager, but it bothers the mom or dad. And then that creates some discord in the home. So there's always some kind of psychological something going on.
How do you deal with that when it affects the mom or dad? What do you do then?
Well, there's no way, if it doesn't bother the child at all, and you have to kind of assess whether they're just not telling you that it does, but if it really doesn't bother that kid, he's not going to use his medications. And just that hassling and hammering on the child isn't really going to, it's just going to be a lot of frustration for the parent. So I basically say to the kid, I'd like to treat your acne. I think that you'd be really happy with clearer skin. And if you can see your way to wanting that or being consistent with a regimen, let's do it.
But you don't force them. You don't. at least what I'm reading is that if the parents are the ones who are more the ones who are worried about it, you don't say to the kids you have to do it, but rather on their own terms. Is that right?
Right, because the other way that it goes is that you prescribe several medications. The parent pays these co-pays and the office visits, and then the kid isn't using them, and then they're at each other's throats about all the time that they've taken and money that they've spent, and it's not being used. So I think you have to establish in the beginning, are we treating now? Are we, kind of going forward?
What your goals are.
Yeah.
I would also say even more, I would say if I were the parent, if your child is not bothered by acne, one of the biggest problems with acne is the psychological effects. If you are, hammering your kid about the fact that you don't look the way I want you to, I mean, that's going to be more adversely affecting the child rather than the acne. So, if you're watching at home, if this is something that's happening to you where your child's appearance is bothering you, don't hammer them, because this disease affects you psychologically, sometimes inside more than the outside. So I mean, I'm dismayed. I didn't know that happened very frequently. If it does, it makes me feel really bad for the kids. What can the viewers at home do to prevent acne? Is there any advice that you can give them to prevent breakouts or even prevent acne from coming on?
Well, they're going to get acne because 80% from 11 to 30 are going to have acne. So you're going to have that tendency to a greater or lesser degree depending upon, like I said, your genetic factors. And it's important to know it's not a hygiene issue. So I can't just say clean your face more. But what I can say is at least just keep your skin, just do a regular face wash and don't apply things that make acne worse. So there are things that we do. Well, if we over cleanse, or for girls, they start to use a lot of concealers and things that are very clogging, or different types of makeup, or different oily products on the skin. Even if you're just avoiding those, comedogenic is the word we use. So avoid comedogenic products, or look on a label for non-comedogenic products. That's helpful. But you're going to get some acne, and then just seek advice on what to do to avoid it getting worse, avoid it scarring.
Perfect. So good advice. That the majority of people are going to get the acne. So instead of harping on it and saying how am I going to prevent it, just do what you can. Use a simple cleanser. Use general principles of cleaning your face, but don't go crazy doing it. And then if you're somebody who really worries about the appearance, don't do things that could actually bring on the acne even worse. We don't have much time, but any thoughts on alternative treatments for acne? What do you think about that?
I don't advise any alternative or plant-based or that type of thing. I think that there's some good regular treatments, prescription and over-the-counter, whether it's benzoyl peroxide over-the-counter or a vitamin A derivative called a retinoid. That's a prescription strength. So I kind of stay mainstream with acne treatments. The only thing I would say is that some of the acids, glycolic acid, salicylic acid, and those can be, like glycolic acid is more of a plant-based or natural acid. That I do believe in. I think that's a really great product to take away the stickiness of the oil in the cells, and at the very least unclog the pores and also make the medications penetrate a little bit better. Perfect.
Great advice. I really appreciate everything and your insight about this disease. When we come back, we'll have questions we'll answer from the studio audience. Please don't go away. I have some adult acne. I say, you know what, I have all the problems of an adolescent, but none of the benefits. You wonder, I should have outgrown this. How come it's still happening? Welcome back. We're now back to take questions from our studio audience. Yes, sir.
Doctor, how do I get rid of blackheads and then keep them from coming back?
That's a real common concern. Well, almost everyone has something they can extrude from their pores. So some people think they have blackheads or blocked pores because they're squeezing and they're getting sebum or oil out. So you don't have to do, that is actually normal. But if you really have a plugged pore or blackheads, I think some of the acid products that are out there, glycolic acid, salicylic acid, are really helpful.
Great, great advice. You know what? And the other idea is that if you're having those questions, again, be proactive, see your doctor early, so you can get education. Now, is it different when you have kids that come in with these kind of concerns versus adults? Do you do anything differently?
Excuse me, I do. The teenage skin is likely to be more oily, more tolerant of some of the stronger acne medications, and less likely to get irritated. Whereas as we get older, we may develop more sensitivities. So I have to offer different things to the more sensitive skin adult patients.
Perfect. Next question.
Hi, doctors. Actually, that was my question. I wondered what the difference in treatments were for adults as opposed to children.
Well, keep going. Anything else you would say about that? I mean, because you have the same disease that just extends to adults.
Well, there may be different triggers, and specifically, and this may be part of your question or apply to you, adult women out of our teen years getting acne. There may be more of a hormonal component, and I think that was spoken to a little bit earlier with, using treatments that may affect that trigger for acne. So sometimes we do offer adult women things that will address the hormonal stress factor for their acne.
Let me ask you one thing about the difference. Now, is the self-esteem factor different from adults than children?
It can be extreme on both ends. In some ways, they have different pressures on them. Our children have pressures in terms of school. They're selecting courses and activities, and they want to feel good about themselves. And although a girl can put on some makeup, she doesn't want to go with caked makeup to school, and certainly not to junior high. Adults have other pressures on them, job interviews. And they don't want to go to a job interview with a big blemish on their cheek. Or in their career, maybe they are doing something in front of the public eye. So they have different pressures, but it really is, I see just as much effect on their psyche and pressure on them in terms of the acne with adults as I do with the kids.
Now, what about the fact that most people think, well, I should have outgrown this, and why do I still have it? I mean, this sense of frustration, because I've always said, whenever I have some adult acne, I say, you know what, I have all the problems of an adolescent, but none of the benefits. You wonder, I should have outgrown this. How come it's still happening? How do you deal with that?
Well, I tell people that you grow out of some things and you grow into others. And some people, acne in adults is commonplace. It is not just a teenage condition. So I have a lot of patients who are saying, okay, now I need something that can target the acne and the wrinkles, and that's unfair. That I'm on, having both issues at the same time. But it happens all the time, and there actually are products that can address skin aging and a tendency for acne. So
that's great.
That's great too.
Next question. Yes, sir.
Hello, doctors.
Hi.
Can acne run in families?
What do you think, Dr. Sadoff? The family history. I know that Desiree had her mom that was still having acne in her 60s.
I think that is a real big factor, and the opportunity in that is that as an adult, if I've had severe acne and I've had to deal with that, get my kid in there fast, because sometimes the acne doesn't look so severe when you look at the patient, but it can lead to scarring, and it can be, let me say, underappreciated in terms of the potential for scarring. So I think that the genetic tendency is really strong, and I just would use it as an opportunity for early intervention.
So again, we've talked about this again and again. You can't change the cards you're dealt, right? And so it's what you do when you have this tendency. Do you sit back and say, I'm going to get it and just do nothing about it? Be proactive again. But the other key is don't let it become so encompassing that every time you get a lesion that you think this is what's going to happen if somebody in your family has had a bad attack, but rather take the information, understand that you may be more at risk, but try to take that information and go see your dermatologist or your doctor maybe a little quicker. Would you agree?
Absolutely, and I also would urge parents that even if they don't remember, or maybe it didn't bother them, or maybe because people didn't treat it as much back then, don't assume that it doesn't bother your child, or that they will be similarly affected or not affected as you were. So some people say, well, I went through it, I dealt with it. It's not a big deal. Well, that may not be the same experience that your child is having.
It's a great bit of advice. You know what? In kids nowadays, and may have different pressures than their parents did. And so acknowledge the problem, address it. Again, don't let it take over their lives, but really be an advocate for them so they don't go into this depression or decreased self-esteem. We have to take a break. When we come back, more questions from our studio audience. Please don't go away.
So if you strip your skin of all the natural oils because you think that it's just because your skin is too oily or dirty, then I give you a medication that you're supposed to apply. That medication is more likely to be irritating, causing redness and itching and scale.
Welcome back. We have more questions from our studio audience. Yes, ma'am.
Hi, doctors.
Hi.
Is acne caused from stress then, or they're not washing properly?
That's a great question. It's a big myth. What do you think about that? Is acne caused by stress or not washing properly or being unclean?
Well, so two parts. The stress. I think stress does play a role in acne. And so I would say it's not caused by stress. And I think that's important to note, but it certainly can be aggravated by stress. It's a hard thing though when a patient asks me, which they do all day long, can this be caused by stress? And I basically say it's not caused by, but it's not being helped by your stress, especially if the stress is resulting in you picking at your skin, becoming anxious, being upset about it. And the thing that's tough about saying, yes, it's caused by stress, is the stress is already a difficult thing that you're dealing with, and then to say now it's causing you your acne. So it's like the job was already bad enough, it was stressful, now it's causing me my acne, is really a tough thing for a patient to hear. So how I deal with it, as I say, it probably is a trigger for your acne. How can we look at reducing that stress, what's going on? And sometimes a person needs some help in dealing with that, but if the stress is resulting in picking and that anxiety and in front of the mirror where they can't stop picking, I oftentimes will recommend a sign on the mirror to remind them not to do it, and then maybe offer them a clay-based mask, something that would be soothing and improve their acne, so that when they feel like picking, they can maybe apply a treatment that's safe and beneficial that they can do at home. They get 15 minutes to kind of chill and reduce their stress and calm down, and then they can splash it off, and then they've revealed skin that's calm, not been picked at, and they can then feel that they've done something positive for their skin as opposed to been aggravated, stressed out, anxious, picked their skin, and then look what I did to myself kind of thing. Because that leads to more stress, leads to more breakouts, leads to more picking, leads to more, it's a bad cycle.
It's a great tip. You know what, that stress will not cause it, but can make it worse. And the other caveat is that when you're stressed, you're picking at things, and the more you pick, the worse it gets. The second part of that question is that, am I just not cleaning myself properly? And Desiree kind of pointed to that. You know, you feel like people look at you and say, are they just not very clean? I wish they just washed their face. And it's a complete myth. You know, of course, use gentle cleaners, but don't get in the habit that people think I'm not clean enough, and maybe I'm not clean enough, and scrub. And what does scrubbing do and making vigorous cleaning? It actually makes it worse, right?
It can really make it worse, and also leave your skin in a state that it won't tolerate the medications that we prescribe. So if you strip your skin of all the natural oils because you think that it's just because your skin is too oily or dirty, then I give you a medication that you're supposed to apply. That medication is more likely to be irritating, causing redness and itching and scale, and not be able to be tolerated, so that you won't benefit from it. Exactly. So just a gentle cleansing that it actually maintains what I'll call the skin barrier, and then apply the acne medications.
Perfect. Another question. Yes, ma'am, please.
Hi, doctors. Are there certain foods I should avoid for acne? I even tried becoming a vegan, and I still have acne.
Another maybe a myth out there about foods. I'll let you address that. What do you think about foods like don't have greasy foods, don't have chocolate? What do you think about that?
I think it's all part of kind of what can I do to control my disease to make it stop. So can I wash more, change my diet? You know, it's just you don't feel like you're in control of this, and to a certain extent you're not. Changing your diet, I don't believe, is going to really lead to a great impact, positive or negative, on your acne. I do recommend just a general healthy diet. If someone is really, you know, just living on fast food, that's not going to be healthy for their body or their skin in general. but a specific diet, especially for someone like a teenager that has a difficult time with that, I do not recommend. There are some people though that say, you know what, when I eat peanuts, I break out, and that makes sense to me, you know, and I say, then watch how many peanuts you eat. I mean, you can adjust it without really going to a dramatic restrictive diet. So I think it's all part of trying to get control on the condition.
Exactly. You know, and in summary, again, you know, no evidence overwhelmingly that any foods make a difference. There's a bit of evidence that maybe some carbohydrate-rich foods can make a difference if they make your blood sugars go up. But again, not across the board. So I agree. Don't restrict foods that, you know, we don't know that it will actually make a difference, especially with adolescents. Well, this time I'd like to thank my guests, Desiree Hacken and Dr. Sadoff. Thank you again for all your time. Really appreciate it. When we come back, Partha's Prescriptions. Please don't go away. Welcome back. Acne can be a real problem for millions of Americans. What can we take away on today's Partha's Prescriptions? First, if your acne is not being treated with over-the-counter medicines, please see a doctor. There are effective treatments that are available today. Second, don't let your acne affect who you are. Don't allow this disease to change your self-esteem. If you feel dejected or frustrated by acne bouts, please see your doctor. Although tempting, don't squeeze to get it out. Wait for treatment to work. Squeezing may leave a scar. In general, patients with acne shouldn't pick, scratch, pop, or squeeze your acne bouts. Lastly, clean gently. Scrubbing your skin will not get rid of acne. In fact, it can irritate the skin and make your acne worse. Finally, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you. That word is namaste. So namaste to each and every one of you. For more information on the treatment of acne or an archive of our previous topics, please visit our website at www.askdrnandi.com. Also, visit us on our Facebook and Twitter site. Thank you very much.